potassium and a unique set of polyphenols that work together to stimulate what researchers call natural diuresis, which is simply your body's ability to produce and release urine efficiently without the harsh side effects that come with pharmaceutical diuretics. A study published in the Journal of Alternative and Complementary Medicine in 2009, conducted by researchers at a Canadian university, found that dandelion leaf extract significantly increased urinary frequency and volume in healthy adults within just 5 hours of consumption. And what made this study particularly impressive was that the participants did not experience the dangerous potassium depletion that commonly occurs with prescription diuretics, because dandelion naturally replaces the potassium your body loses during increased urination. This is a massive deal for anyone over 60 because potassium depletion is one of the primary reasons doctors hesitate to prescribe diuretics to older patients, since low potassium can cause muscle cramps, heart rhythm irregularities, and severe fatigue. The way I prepared this compound each night was remarkably simple. I took dried organic dandelion root, which you can find at virtually any health food store or online, and I simmered 1 tablespoon of the chopped root in about 8 ounces of water on low heat for 15 minutes, then strained it and let it cool to a comfortable drinking temperature before consuming it roughly 1 hour before bed. The key to getting maximum benefit from dandelion root is the simmering process, because unlike regular tea where you just steep leaves in hot water, the tough fibrous root needs that sustained gentle heat to fully release its active compounds into the water. You will notice the liquid turns a deep amber brown color, and it has an earthy, slightly bitter taste that honestly grows on you over time. Some people add a small amount of raw honey to make it more palatable, and that is perfectly fine because honey does not interfere with the active compounds. Within the first 3 nights of taking this, I noticed that my first morning urination was noticeably stronger and more complete. That feeling of still needing to go even after you just went started to diminish, and over the course of about 2 weeks the improvement became consistent and unmistakable. What researchers believe is happening at the cellular level is that dandelion root compounds gently increase blood flow to the kidneys while simultaneously supporting the tiny filtering units called nephrons, helping them work more efficiently without being overstressed, which is exactly the kind of gentle, sustained support aging kidneys desperately need rather than the aggressive forced filtration that pharmaceutical drugs often create. The one important thing to know is that if you are currently taking lithium or any potassium-sparing medications, you should absolutely talk to your doctor before adding dandelion root to your routine, because it can interact with those specific drugs. For everyone else, this is one of the safest and most well-tolerated kidney support compounds available, and the fact that it costs almost nothing compared to supplements makes it even more appealing. But as good as dandelion root is, the next compound on our list takes kidney flushing to an entirely different level. Before we continue, take a second to like this video and subscribe. There's even bigger insight right after this. Number 4. Parsley seed infusion. Now here is something that absolutely blew my mind when I first came across the research. Parsley, that little green garnish sitting on the side of your plate that most people push aside and never eat, contains one of the most potent natural kidney cleansing compound profiles ever studied in clinical settings. Specifically, parsley seeds contain concentrated levels of apiol and myristicin, 2 volatile oils that have been demonstrated in multiple studies to increase the rate at which your kidneys filter blood and expel waste products through urine. A fascinating study published in the American Journal of Clinical and Experimental Urology examined the effects of parsley extract on kidney function in aging subjects and found that participants who consumed parsley-based preparations daily showed significant improvements in glomerular filtration rate, which is the gold standard measurement doctors use to assess how well your kidneys are actually cleaning your blood. The researchers noted that the improvement was particularly pronounced in subjects over the age of 65, suggesting that parsley's active compounds may have a special affinity for supporting kidneys that are already experiencing age-related decline. What makes parsley seeds different from the leaves most people are familiar with is that the seeds contain dramatically higher concentrations of these kidney-active oils, sometimes up to 10 times more than what you would find in an equivalent amount of fresh parsley leaves, which is why traditional herbalists throughout the Mediterranean and Middle East have specifically used the seeds rather than the leaves for kidney and urinary complaints for hundreds of years. The way I prepared my nightly tablespoon was straightforward and easy to replicate at home. I took 1 tablespoon of dried organic parsley seeds, lightly crushed them with the back of a spoon to crack open the outer shell and release the oils inside, then placed them in a cup and poured freshly boiled water over them. Covered the cup with a small plate to trap the volatile oils that would otherwise escape as steam, and let it steep for a full 10 minutes before straining and drinking the warm golden liquid. That covering step is absolutely critical, and most people skip it. But if you leave the cup uncovered, those precious volatile oils literally evaporate into the air, and you lose a significant portion of the therapeutic benefit. The taste is surprisingly pleasant, mildly herbal with a slightly warm, peppery note that most people find agreeable without any sweetener. I drank this about 45 minutes before bed, and by the end of the first week, I noticed something remarkable. Not only was my nighttime urination becoming less frequent, but when I did go, the flow felt more complete and satisfying, like my bladder was actually emptying properly for the first time in years, rather than giving me that frustrating, dribbling, incomplete sensation that so many men and women over 60 struggle with silently. Researchers believe this happens because parsley seed oils help relax the smooth muscle tissue of the urinary tract while simultaneously promoting more efficient kidney filtration. So you get better flow mechanics and better waste removal happening at the same time, which is a combination that very few single compounds can achieve. Another wonderful benefit I experienced was reduced puffiness in my ankles and lower legs by morning, which tells me that the kidneys were doing a much better job of clearing excess fluid overnight rather than letting it pool in my extremities while I slept. If you have any history of kidney stones, particularly oxalate stones, you should know that parsley is moderately high in oxalates, so please consult your healthcare provider before making this a daily habit. But for the vast majority of older adults, this is an incredibly safe and effective compound that delivers noticeable results quickly. It is also worth noting that pregnant women should avoid concentrated parsley seed preparations, as the apiol content can stimulate uterine contractions. But for our audience of adults over 60 focused on kidney health, this is generally not a relevant concern. Now, if you think parsley seeds are impressive, wait until you hear what the next compound did to my kidney markers. Number 3. Celery seed extract. If someone had told me 5 years ago that tiny celery seeds would become one of the most exciting areas of kidney research in modern urology, I would have laughed. But the science behind what these unassuming little seeds can do for your renal system is honestly staggering, and it deserves far more attention than it currently gets. Celery seeds contain a powerful compound called 3-butylphthalide, often abbreviated as NBP, along with significant concentrations of luteolin and cedanolide. And together, these compounds create what researchers describe as a comprehensive kidney support trifecta that addresses inflammation, blood flow, and waste filtration simultaneously. A pivotal study published in the Journal of Pharmaceutical Biology tested celery seed extract on subjects with early-stage kidney dysfunction and found that after 8 weeks of daily supplementation, participants showed a statistically significant reduction in blood urea nitrogen and creatinine levels, which are the 2 primary markers doctors check to evaluate kidney performance, and remarkably, the subjects also reported substantial improvements in urinary comfort, flow strength, and reduction in nighttime bathroom visits. What makes celery seed particularly special compared to other kidney-supporting compounds is its powerful anti-inflammatory action on the renal blood vessels themselves. Because one of the biggest reasons kidney function declines with age is that chronic low-grade inflammation causes the tiny blood vessels inside the kidneys to become stiff and narrow over time, reducing blood flow and making it harder for the nephrons to do their filtering job properly. The NBP compound in celery seeds, directly addresses this by relaxing vascular smooth muscle and reducing inflammatory signaling molecules in the renal tissue, essentially helping to reverse some of that age-related stiffness and restore more youthful blood flow patterns to the kidneys. My preparation method involved purchasing whole organic celery seeds from a reputable spice supplier. Then each evening, I would measure 1 tablespoon and grind them fresh using a small mortar and pestle or a clean coffee grinder until they became a coarse powder, because breaking the seeds open dramatically increases the bioavailability of those active compounds compared to swallowing them whole, where many would pass through your digestive tract unprocessed. I then stirred this freshly ground powder into a small glass of warm water, mixed it thoroughly, and drank it about 30 minutes before bedtime, following it with a few more sips of plain water to ensure everything was washed down properly. The taste is